Hi, Cumberland County. Renee here, a certified sexual health educator and the director at your local sexual health center. Well, winter is here, and so is syphilis. Earlier this week, officials with the Department of Health in Nova Scotia declared there to be a syphilis outbreak in the province, and this is not our first one. So let's talk about this outbreak and how you can mark yourself safe from the Nova Scotia syphilis outbreak. First, let's do a quick review of STIs, and I promise I'm not going to show any graphic images or anything like that. Okay, first common STI is a viral STI. So a viral STI is an STI that's caused by a virus. So genital herpes, HIV are examples of viral STIs. Now these STIs can be treated and can be controlled, but there is no cure for them. The other kind of STI is a parasitic STI, meaning that it was caused by a parasite. Not only can this be treated and controlled, but parasitic STIs can also be totally cured. The other STI is a bacterial STI. Chlamydia is an example of a bacterial STI. It's also one of the most common STIs in the county and across the country. Syphilis is another example of a bacterial STI. So that means that once syphilis is diagnosed, it can be totally treated, cured, and you are good to go. But the challenge is knowing that it's syphilis by getting tested and properly diagnosed. Syphilis and all other STIs have one big thing in common, and that is, of course, that they are passed during unprotected sexual activity through oral, anal, or vaginal sex. For most folks, syphilis shows up as a sore on the genital areas, and that sore is very, very contagious. So when somebody does get tested for syphilis, and if you find out that you have syphilis, both you and your partner will need to get tested, or else you'll just keep passing it back and forth. The thing about STIs, especially syphilis in particular, is that it can mask other symptoms and you might not know that you even have it for many, many years. Some folks can have syphilis in their body for up to 20 years. If you are a youth in the county and are a junior high school student, a high school student, or a recent grad of any of the high schools, talk to your teen health center coordinator and they will hook you up. If you are an adult, talk to your family doctor, your nurse practitioner, go to a walking clinic, go to outpatients. We all recommend that everybody gets tested at least once a year and make it part of your regular health routine, but you should get tested more in certain circumstances. You also need an STI test if you have had sex without using a condom, work, or the condom broke. If you are having sex with new partners, if you or your partner is having sex with someone else, every time you change partners, even if you've just been on a small break, if you find out that your last partner had an STI, if you've ever injected drugs, you want to get tested for an STI if you've been raped or if you feel that you have or you think that you have been raped. And contact us here at the Sexual Health Center if you have any questions. Communication is really key. A lot of people think that, if you have an STI that you're dirty or you're unclean, and that's not the truth at all. Everything is manageable. No matter what that test comes back at, everything is manageable. We just need to know what we're dealing with. And again, we're here to help you with any questions that you might have about this and about other sexual health needs. So, on behalf of all of us, have a great, safe, and happy, healthy day.